Good evening, and thank you for joining us for the Detroit Pistons Breast Health Awareness Virtual Panel. I'm Jennifer Hammond from Fox 2, and I am thrilled to be leading this evening's panel discussion. Even though we can't be together in person, we hope that this panel will information on treatment and prevention of breast cancer and celebrates survivors. In this hour-long program, we're going to hear from 4 women who all have unique experiences and perspectives on breast cancer. Please welcome Henry Ford Health System's board-certified breast cancer surgeon, Dr. Lindsay Patterson, breast cancer survivor, Emmy Award-winning TV and film personality and host on 98.7 The Breeze, Kim Adams, and breast cancer survivor, author, certified health coach, and Emmy Award-winning TV host, Samantha Harris, and breast cancer survivor, former WNBA player, and program director for Breathe and Stretch, Edna Campbell. Before we continue, if you have any questions for our panelists this evening, we're going to have a chance at the end of the presentation. You can go ahead and type your questions in the queue down below, and we will address as many as possible after these comments and the presentation. First off, I'd like to start with you, Dr. Peterson. Tell us a little bit about what you do on a daily basis at Henry Ford.
Sure. Thanks. So I'm a breast cancer surgeon, and so on a day-to-day basis, I'm either in the operating room doing operations for women with breast cancer, and that might include a lumpectomy, which is just removal of a breast cancer, a mastectomy, which is removal of a breast, or lymph node operations to stage breast cancer or treat breast cancer that's gone to the lymph nodes. I also see patients in the office before and after their surgeries, and see patients often that are survivors years out after for surveillance examinations. I also take care of patients with high-risk conditions that make them perhaps at a higher risk than an average woman to develop breast cancer.
I know that we talk an awful lot and hear a lot about self-exams and getting routine screening for breast cancer. But why is it so important for women to understand your own personal cancer risk?
I think breast cancer risk is the key, and knowing what your risks are can really help. In terms of screening, women should start screening with mammogram at age 40 to 45, but that's someone that's at an average risk. And there's a variety of things that can increase a woman's lifetime risk to develop breast cancer. Just for some idea, the average woman in the United States walking around has a risk of 1 in 8 of developing breast cancer, 12% in her lifetime. And so some women have a higher risk than this, maybe 15%, 20%, or there's even patients with genetic mutations that make them very susceptible to breast cancer. And so knowing your risk is important. The biggest thing that contributes to risk are things that are out of our control, such as our family history. Breast cancer or ovarian cancer diagnosed at an early age, whether that be in a mother or sisters, is considered a high risk for breast cancer. And then there's a variety of other risks that can contribute to a woman's risk for breast cancer. There is a link to a free risk calculator online, and this is the one that I use to evaluate women's risk, and they could fill it out themselves. And I'd be happy to send it out in the chat at the bottom of our Zoom call tonight, so that people can calculate their own risk. And the important thing to know is if it calculates back a risk of upwards of 20%, so 20% lifetime risk or higher, then a woman should have increased screening in addition to mammogram. And so I think most of us would be familiar with mammogram as an X-ray. For women that are at a very high risk for breast cancer, upwards of a 20% lifetime risk, we tend to add breast MRI, which is an additional screening tool for women that are at the highest risk for breast cancer.
And I know that we hear a lot lately, or I feel like I have when I visit my doctor, about the 2D and the 3D imaging. Can you touch on that and who each might be important for, and how do we know if we need it?
Yeah, great question. The 2D is traditional mammography, and while that's digital now, like everything, no mammography is really done with film. It's similar to cameras, right? Everything's digital now and not really on film. So a 2D mammogram is where the entire breast is imaged in one view. And so the difference between a 2D mammogram and what's called a 3D mammogram or a digital breast tomosynthesis is that a digital breast tomosynthesis or 3D mammogram is one that takes slices of the breast. So it's almost like a CT scan of the breast.
Mhm.
And allows the breast imager to sort of comb through the breast more distinctly versus have one view where we're looking through the entire thing. And that can be of great value to women with denser breasts. And so it's important also to know your breast density. And if any woman's had a mammogram that's on the chat, if you look at your mammogram report, it will say what breast density category you're in. For women that are not very dense or don't have dense breasts, then a traditional 2D mammogram is just fine and is a great tool to detect breast cancers. For women with more dense breasts, then a 3D mammogram is more useful because it's easier for the breast imagers to identify breast cancers in those denser breasts if you have a 3D mammogram, and they can comb through things more carefully.
Dr. Peterson, tell us a little bit, if you can, about who comprises your breast cancer team.
So our breast cancer team is made up of so many people, and so many people that are really key and important to the patients. And I think the person often that they need is the surgeon, because often surgeons have a part in taking care of breast cancer. We work with a tremendous team of nurse practitioners and nurse navigators that assist us with getting patients through the process. They're also, when someone has breast cancer, often they are taken care of by a medical oncologist. And those doctors are chemotherapy doctors or doctors that might prescribe a pill that helps block estrogen or hormones for people that have hormone-rich breast cancers. We also work with radiation oncologists, because a common treatment for breast cancer after surgery is radiation as well to help prevent the breast cancer from coming back. And in addition to that, there's just a team of pathologists that are breast experts looking at the pathologic slides or the surgery slides. There's a team of breast imagers that do the biopsies and are experts at reading breast images. And just so many people in our supportive care and supportive oncology teams that help patients through the process with nutrition, with psychological counseling. So there's just so many members of the team that are really key.
Yeah, it really does take a village. Can you talk to us just a little bit about having patient-centered approach to breast cancer? Because oftentimes anyone hears the word cancer and it's frightening, and there's so many things, that go through your mind as a patient. What does your team do to ensure that the patient receives the best individualized care and treatment?
I think the main thing that we do is everyone that has breast cancer, our institution is presented at our tumor board or our meeting with multiple doctors across the disciplines through every level of their care. And so that's just not a quality control, but so that we ensure that we're doing individualized care for each patient and that it's not just falling into a group or falling into some sort of algorithm. Everyone's treated independently and is discussed individually. I think that the thing that a lot of people don't know about breast cancer is there's many different kinds of breast cancer, which has different individualized treatments. And so that's a hurdle that often we have to get through is the care that might have been appropriate for a patient's friend or for their mother might not be the same thing that is recommended or an option for them. And so everyone's individualized in that way. I think additionally, talking about patients at that level at our tumor board every time, we know what's important to them. It's important, for example, for young patients, if they might be in childbearing years, to think about that sort of thing as we go on to start their cancer treatment. There's some women that might be genetic carriers that we might be thinking about reducing their risks for a possible future cancer at the same time as treating their current breast cancer. And breast cancer is also a field that there's not just one surgical choice often that's appropriate, or one operation that treats the breast cancer. Sometimes women have choices and there's pros and cons to each choice. And so it's important to make sure that we educate our patients so that they can make the right choice for them.
And it certainly seems like there's been advancements and in medicine and research that have impacted treatment over time. What kind of things can you tell us or share about that just a little bit?
Yeah, I think that the main advancements in breast cancer recently have been an improvement in specific treatments for triple negative breast cancer and in HER2 positive breast cancer. So cancers that we often give chemotherapy for. There's been a dramatic shift in terms of recommending that those treatments, maybe we do them before surgery, which can decrease the amount of surgery that we have to do for patients, which I think is amazing. One of the big morbidities in breast cancer can be lymphedema or development of arm swelling after having lymph nodes removed under the arm. And one of the big advancements that we have at Henry Ford is now our plastic surgeons are offering operations that can reduce the risk of lymphedema for women that have to undergo a lymph node dissection. And overall, we're just doing less lymph node dissections because research has shown and clinical trials have shown that they're not indicated in a lot of certain situations. So I think overall, we know that treating the breast cancer is important in terms of specific risk factors for recurrence, and a bigger operation might not always be the answer. And so to individualize surgery and have more precise medicine for people has been the biggest changes recently.
That's true. A lot of great information there. Thank you so much, Dr. Peterson. We're going to move on now to our panelists who have so graciously agreed to join us and share some of their very personal stories as well. I'm going to start with you, Kim, and we'll get around to everyone. I just would like you, if you can, to share with us and the viewers on the panel today on the Zoom call here, a little bit about your story and your unique journey with breast cancer.
Well, first, thank you so much. Thank you to everyone for being with us. It's an important conversation and one that I wish that I would have had prior to my diagnosis, because I really didn't know that much about breast cancer. No one in my family had breast cancer other than doing the breast cancer walk every year. That's all I knew. My journey started 4 years ago, actually almost 4 years ago to the day. It was October of 2016, and I'd had a tough couple years. I had gotten divorced, went through a very messy situation. I'm a single mom of 5, but things were finally looking up. My 5 kids and I were doing well, and I was making them breakfast. And I remember bending over to pick something up, but I had a nightgown on. So I just kind of held my nightgown against me, and I felt it. I felt a lump, and I knew. I just had that instinct that I thought, not now, not now. But I knew it wasn't right. So I went right to my primary doctor that day, and she said, "Oh, it feels like a cyst." She said, "It's totally fine, but you're almost due for your yearly mammogram," which I'd been very good about getting yearly mammograms. She said, "Just have your mammogram and it'll be fine." So I went for my mammogram. Mammogram came back normal, but it still didn't seem right. So I went to my OBGYN, and she said, "Yeah, it's probably just a cyst, but let's get an ultrasound just to make sure." So I did the ultrasound, and I'll never forget the technician. I mean, it took maybe 15 minutes. She left, came back in. I never even saw the radiologist, and she said, "Okay, everything's fine. It's just a swollen lymph node. Everyone has them. Just come back for your yearly mammogram." And as soon as she said it's just a swollen lymph node, I instantly thought of a woman named Joy. Joy was a naval officer who I was friends with. And about 5 years before, she'd felt a lump under her armpit, and they told her it was a swollen lymph node. This was in March, and she was a single mom with 2 kids. By November, I was going to her funeral, watching 2 sons bury their mother. So as soon as they said swollen lymph node, the hair on the back of my neck stood up. I went to, long story short, 2 more doctors, and they said it's just a swollen lymph node or a cyst. So finally, after the first of the year, I went. She felt it, took one look at all my labs and said, that needs to come out. I said, oh, okay, when? Tomorrow. Oh, okay. So I was immediately scheduled for a lumpectomy. And 3 days later, I was with my son, who was 4. We were at the library playing Candyland. It was one of those just great mother-son moments, and my cell phone rang, and I knew I had to answer it. And it was my surgeon. And the conversation was maybe a minute long. She said, Kim, I have bad news. It is breast cancer. It's invasive ductal carcinoma. And she goes into, I couldn't even hear anything after that. I just heard that it was cancer. And so I stayed calm and I went home. And, you know, cancer doesn't stop your life. When I got home, you know, I have 5 kids and I'm a single mom, and I'd just been diagnosed with breast cancer, but my 3-year-old had, you know, pooped his pants. The older kids are like, where are you? We got to get to volleyball. We have to get to tennis. What's for dinner? I'm starving. And I thought, oh my gosh, like, the angels didn't sing, and people didn't gather around, and life isn't going to stop. I've got to get through this. And so I put on my big girl pants and I booked a trip actually that night to Disney World. I didn't tell my kids. In fact, I didn't tell anybody except my mom. But I didn't tell anyone because I wanted one last vacation with my kids where they didn't know, where nobody knew, no one treated me any differently. So 2 days later, I woke them up. Instead of going to school, I said, hey, you guys want to go to Disneyland? So we went to Disney World and had the best vacation. And when we came back, I had a double mastectomy, followed by 2 years of surgeries and treatment and fear and resilience. And let's see, a year ago, almost a year and a half, I'm in remission now.
Yeah, that's amazing.
Yeah. So, and I just want to say, you know, the doctor was talking about dense breast tissue, and I believe Samantha has the similar story to me. I had done my mammograms just like I was supposed to do, but if you're a woman listening right now, you need to know what breast tissue you have. Because a year before, I had gotten a letter after my mammogram saying that I had dense breast tissue. And I took it to my regular doctor, and she said, yeah, the state's required to send these out now. She's like, most women have dense breast tissue. It's fine. Just get your regular mammograms. Now, if I had waited and not paid attention, if I had known that I had dense breast tissue, I would have probably gotten different imaging for my mammogram. And it might have changed, you know, mine had already, you know, it could have stopped it earlier. I could have found it much earlier. But they described it as a snowball in a snowstorm because dense breast tissue shows up as white on a mammogram. Mm-hmm. And if you have a tumor, it's white as well. So it's like a snowball in a snowstorm. You just can't see it with the regular imaging. So it's really important that you know what kind of breast tissue you have.
Tell us a little bit. I mean, I'm so awestruck by your story and your strength and what you did for your children. I think that's very remarkable. But a little bit about the support system you had. I mean, going through a divorce and being a single parent is hard enough. You said you told only your mom. Where did the other support come from in your life through the diagnosis and the surgeries and the months of treatment?
Well, my parents were my main source of support. They were the ones that watched my kids while I went and had the surgeries. I didn't tell a lot of my friends, and I think that's a problem that women struggle with because we don't want to bother someone. We don't want to ask for help. I had one friend that would just literally show up at the hospital because she knew I wouldn't ask. But when I went for my breast reconstructive surgery, it was so early in the morning. I had to leave at like 4:30 in the morning, and I didn't want to bother anyone. They all have kids, they're getting them ready to go to school, all that. So I had an Uber come and get me. And I'd never Ubered before, but I took an Uber to my surgery. And my friend met me at the hospital, and she's like, "You're not doing this alone. Stop it." Um, and my mom felt terrible because she wanted to be there, but she knew the most important thing for me was knowing that she was with my kids. But if I had advice for women, ask for help, because it's not just for you. People want to help. And if we just accept that, they don't know what to do, they don't know what to say. So if you allow them to help, it actually makes your friends and the people around you feel better because they feel like they're doing something. Otherwise, they're just helpless. So I wish that I had reached out a little bit more and not tried to do everything myself. But I think that's just kind of the way that we're wired. And it's something that, especially as women, we need to kind of deprogram ourselves and accept help when we need it.
That's great advice. And I suppose too that it was that type of strength though that helped you also get through the whole diagnosis and
It
your
did,
cancer
and
battle.
my kids were amazing because their lives didn't stop and they were caring, they were worried, but they kept their routines as normal as possible. And that made me get up every day. I had a reason. I had to get through it. It made it easier because you don't have a choice. I couldn't just stay in bed all day and feel sorry for myself. But we also have to give ourselves grace. You hear fight like a girl all the time. Well, sometimes it's okay to cry. And sometimes you don't feel like fighting. And sometimes we have to give ourselves grace that we don't have to be strong all the time. Sometimes you can, cry like a girl and cry like a baby if you want to, but give yourself grace. And I always tell people that reach out to me who've just been diagnosed, and I tell them, you've got to go through the emotion of it. Kind of learn from my mistake where I felt like I had to do it all and be strong all the time. You don't have to do that. You can be vulnerable and it's okay. There's a beauty in that.
Thank you. That was really a beautiful story, Kim. Samantha, are you ready here to step up and share with us?
Absolutely.
Give us a little sense of what your journey, your diagnosis was like.
Well, I mean, honestly, for those of you who are, we're there to just listen to Kim. I mean, really, Kim, you hit it on the nail on the head. We really have incredibly similar stories, from the snowball in a snowstorm to the having doctors tell you it's nothing. And that's really the craziest part of my journey. So people kind of know me from doing Dancing with the Stars and Entertainment Tonight. I was always on the go, sitting in a makeup chair, getting shellacked with, gosh knows what kind of chemicals all over my face and hair and body on a daily basis for year after year. But yet I felt like I was in the best shape of my life. I felt like I was energized, just about to turn 40. My kids were 3 and 6 at the time. I had lost my dad to colon cancer. He had been diagnosed at 48. He had Crohn's disease. They didn't follow him closely enough. So he passed at 50. My husband is now 50, and I realize how young that is. My dad's mom was a breast cancer survivor, postmenopausal diagnosis, lived to the ripe old age of 95. But because I'd had cancer in my family, I thought, well, I'm turning 40. I hear all these things about this mammogram thing. I should probably set a baseline while I'm so fit and healthy and strong, and let's do this thing. So I went in, had the mammogram, got the results back. They were clear, just as what I had assumed they would be. But then 11 days later, I was changing after a workout. And we'll get a little personal here. I'm assuming there's a lot of ladies on the call. After the workout, you have the sports bra on, it's super tight, and you just kind of have to move things around a little bit, get them moving again. And thank goodness I did, because when I did that, I felt a lump on my right breast that definitely had not been there. And I immediately went to see my longtime OBGYN. She saw me a couple days after I found it. She did a quick clinical exam, told me it was nothing, said, you're turning 40. It's probably glandular. This is what lumpy breast is what happens when you turn 40. Sent me on my way. And she was always a non-alarmist. So I truly believed what she had to say. But a month later, Jennifer, that lump was still there. And there was this nagging in my gut, that inner voice saying, if it's really nothing, let's just get a second opinion. But again, not thinking it was cancer because I had just had a clear mammogram the month before. So I went to see my internist and he did the same thing. Quick clinical exam, felt around, gave the old squeeze and said, yeah, it's nothing. If you're worried about it, we'll just keep an eye on it, but go home, enjoy. And then it was the holidays and then it was New Year's. And before I knew it, I came up for area and 4 months had passed.
Wow.
And I thought that nagging was still there. That inner voice now was shouting at me, Samantha, if you're going to live with this lump and it's truly nothing, let's make sure it is nothing. So I called my OBGYN back and said, okay, what kind of doctor do I go see? I want to see someone who looks at breasts every day and they know what to look for in case there's something. So unbeknownst to me, the person she gave me a referral to was actually a breast oncologist, right? Someone who specialized in breast cancer. And I remember walking into this breast center in Santa Monica, California, near where I live. And I thought, it's so weird that the word cancer is all around. I don't have cancer. What am I doing here? And that oncologist was lovely. And she did 2 ultrasounds. They looked at my mammogram. They did a needle biopsy. And she said, look, you're not crazy. There is something there. I see something, but nothing indicates cancer. But the needle biopsy results came back and she said, again, still not saying cancer, but let's just take it out. Let's just be sure. I had never had a surgery in my life. I thought, you know what? Hey, why not? 40, this is what it's going to look like. So she did a lumpectomy. And I woke up from that surgery again, hearing the frozen sections, the quick and down and dirty pathology in the surgery room said no cancer. And I went home, and a week later, when it was time for my pathology results and to look at the incision and see how it was healing, I told my husband, honey, usually I tell a story, I say, just, you can stay home with the kids. Okay, honestly, he went golfing. But I said it was fine because it was a beautiful day. And what did he need to sit in a dreary office with me? It's fine. I don't have cancer. And then I sat there by myself as the doctor started to throw these words out: carcinoma, ductal carcinoma in situ, invasive, drawing diagrams and little dots. And I thought, oh my gosh. And I'm trying to take it all in. So not only did I have ductal carcinoma in situ, which is that breast cancer where the cells, and doctor, please, of course, correct me if I'm wrong on this, the cells are contained within the duct and they're not smart enough to get out. But what was interesting is that during my surgery, thank goodness, and this is where finding the right doctors, there are so many great doctors in most of our cities, but really making sure you go to people who have done this and they do this all the time. She listened to her gut in the surgery room during that lumpectomy. And there was a little bit of tissue that she said was on the margin. And she said it looked like healthy tissue, but I just wanted to sample it. I don't know why. Something in my gut just said I should take a sample. And thank goodness she did, because it was that sample of what looked like healthy tissue that actually was invasive breast cancer. So the tip of the iceberg, we had no idea what more could potentially be there. So after lots of hemming and hawing and weighing all my treatment options, lumpectomy again, but with this time with radiation, or do I do a unilateral or bilateral mastectomy? I chose that for me, the right choice was the double mastectomy with reconstruction. So in 2014, I had 3 surgeries over the course of that year: the lumpectomy, the mastectomy with reconstruction, stage 1, and then stage 2 reconstruction. And I have to tell you that what baffled me the most, Jennifer, is that, being a journalist by trade, so you can feel me here, I had no hereditary link. I did the BRCA testing and the diagnostics that were available to us at that time, 6.5 years ago, and I had no hereditary link to my dad's colon cancer, because sometimes there's a breast colon connection. I had no link to my grandmother's breast cancer, and I was baffled. And what I've come to learn, and I'm also a national ambassador for the Susan G. Komen Breast Cancer Foundation, only 5 to 10% of breast cancers, and again, doctor, please correct me if I'm wrong, are hereditary. So I thought, okay, the journalist in me wanted to know, why are 1 in 8 women being diagnosed with invasive breast cancer over the course of her lifetime? And what do we do about it? And as I began to research and dig deeper and deeper, I found that it is truly what we put in, on, and around our bodies that can have that effect on our overall wellness, that can turn on or off certain cancer genes that might be lying dormant, mess with our DNA, right? The epigenetics, the study of what turns the genes on and off is pretty phenomenal. It's very much in its early stages, but it's really amazing. And so I started to make changes in my life, how I was eating, why I was exercising, the reason behind things, the toxic relationships that were driving up my levels of cortisol, the stress hormone that lead to inflammation, and inflammation that leads to chronic diseases, and making changes with the beauty products I was using while I was in the makeup chair for my different jobs, how I was caring for my family with our cleaning products in our home. And I did a real overhaul, and it really is what led me down the path to lead my healthiest healthy life, to write my book, Your Healthiest Healthy. And then now doing webinars, retreats, and private one-on-one coaching. And I went and became a certified health coach over the last few years because I wanted to be able to help others open their eyes to what we can do to control what we can control. And I know there's only so much we can, but we can control a lot.
That is an amazing story, both of your stories, ladies, so far. And we're going to hear from Edna here in a moment. Give me a sense, just if you can, Samantha. I mean, obviously, your husband went to play golf that day. Give me a little bit of insight into the support you had from him at home, and where else you got your strength.
I mean, you know, I barely got through the conversation on the phone to just say, meet me at there's a park near our house. I couldn't go home with knowing my little girls were playing and just wanted their mommy, and I needed to process this. And let me tell you, he never missed another appointment after that, and was at my side every step of the way. The support, the caregivers, you know, I think sometimes we forget as patients just how challenging it is for the caregivers in our lives. You know, whether it's my husband, my sister who flew in from Minnesota, where I'm from, then my mom flew in. It was like a tag team. My mother-in-law, my second cousin on my husband's side. I mean, it was just that incredible supportive community, because I think, as Kim said, people want to help. And when people ask my advice for, well, gosh, what should I do for somebody?
Mm-hmm.
Don't ask what to do. Tell them. Say, I'm going to bring dinner over Tuesday and Thursday this week. Do you want, you know, the veggie lasagna, or do you want the chicken? We already have so much going on with Cancerversity, which is like trying to figure out all that we need to learn about dealing with the diagnosis, dealing with all the life events that are continually going on, as Kim said, that life isn't stopping. So having that support squad around you, but also knowing that you need to be able to ask as a patient, and empower yourself to ask people for that help, which is really hard to do when we're used to being the caregivers.
Mm-hmm. And a lot of women say that all the time. We're the caregivers. It's hard to ask. And you're right. I love your point for the advice is to not ask someone what they need, but just to tell them what you're going to do. I'm doing this for you today. Mm-hmm. All right. I'm going to come back to each of you, Kim and Samantha, with your remission wishes and kind of goals for remission. Edna, let's get you up here and hear a little bit about your story. This, obviously, it's awesome and emotional, and these are such everyday stories. I feel like we're all everyday women, and yet this gives you a snapshot of how breast cancer really touches anyone.
Without a doubt. Thank you. Wow. As I was listening to those stories, I was just thinking about my stories and just realizing how many, I'm going to say, just a lot of common ground in those stories. When I was diagnosed, it was back in 2002, and I was in the midst of my professional basketball career. And as Samantha was saying, you know, you feel like you're fit as a fiddle and your life is great. And I, at the time, was playing for a team in Italy. So as a WNBA player, in our off seasons, we would go overseas. The WNBA season is only 3 or 4 months long, and we would go to Europe or to South America, to Asia, and we would play with their leagues as well. And as I was saying, I was in Italy at the time and enjoying my life, learning Italian, learning how to cook, and just really feeling like I was at the top of the world. And as you would suspect, being a professional athlete, you know, I'm feeling like I'm taking the best care of my body, and my body is well tuned. So we were at the end of our first half of the season. Our season would start in September, go to December, and we would have a Christmas break. We were going against our top rival in the league, in the Italian league, and I was guarding the best player on that team. And if anyone knows about basketball, usually the best player, the other four players work to get that player the ball, right? And so you have to run through a lot of picks, and a pick is when another person, so that person's teammate will come and place their body against that person's defender to impede their motion, right? Okay, so I had to run through a lot of picks, and this one particular pick, her teammate came up to me, she planted her feet, she protected her chest, and as I collided with her, she added, for emphasis, a little elbow, right? So not only did I run into her body, I ran into the elbow as well. And that elbow hit me smack dab in my right breast. Okay, so, you know, I felt that impact, but then I kept on playing, and, you know, we finished that first half of the game, and I get into the locker room and I'm like, whew, man, she got me good. And all I'm doing is talking to some of my English speaking Italian teammates, and I'm telling them, hey, she elbowed me, cotovelo here, you know, and, you know, with my mixed or broken Italian, I'm trying to tell them what happened. And they're like, yeah, we're going to get her. We're going to get her. You know, at the time, you know, I did not realize that that player was heaven sent. She was really, I feel like an angel. So that, where she elbowed me actually was in the lump. But unbeknownst to me, as an athlete, whenever you have an injury, all you do is ice, right? You have a bruise, you have whatever the ailment is, you ice it. So that night after the game, I'm just sitting there ice packing my breast, and I'm just like, you know, taking a little Advil. I'm just thinking, okay, the swelling's gonna go down and I'll be back to normal. Well, of course, the lump, it did not subside. The pain did not subside. And I'm starting to feel this pang in my stomach. Like, what is this? You know, and it's feeling all grainy. It's about the size of a nickel. Okay. And I'm just like feeling it. And then I start trying to massage it, right? This is just the athlete's mentality. You know, this is a bruise. We're gonna knead it out, and we're gonna get back to life as we know it. Well, after about a week, I could not contain the nagging feeling in my gut. And Samantha, when you talk about that gut feeling, and I think that Kim also talked about, you know, following your intuition. We know when something's off kilter. And I'm going to reiterate my message to anyone listening. If your sixth sense is telling you that something is not right, believe it, trust it. Go see another physician. Go get a second, third, fourth opinion if need be, because you know when something's not right. So it took that, I'm going to say, conviction for me to go to my Italian president and tell him I'm going back to the United States because I was elbowed and I have a lump. As you can imagine, as an athlete, I could not even really get those words to roll off of my tongue because it just didn't sound right. It sounded like I was being a wimp, right? And of course, that statement was met with, are you kidding me? What kind of athlete are you? What kind of competitor are you, right? You get an elbow and you want to go crying and go back home. And of course, he was an arrogant Italian, and he started yelling at me in Italian, and I'm just like sitting there like, well, I don't understand. So I'm just smiling, and I'm like, okay, well, I've already purchased my ticket. I'm going home because I need to find out what is going on with my body. So fast forward, I went, and you know, I went to go see my gynecologist. And back in 2002, you had to have a prescription in order to get a mammogram and subsequent imaging and things like that. So I went through that process. I did get biopsied right there on the spot, but of course they didn't have the results immediately. I jumped back on a plane, went back to Italy, which I probably should not have done, and got the call while I was there, getting ready to leave for a basketball game. And as anyone could imagine, that's when your world just shifts upside down. You feel like you're frozen in time with those words in your ear. I was very fortunate to have my WNBA family corral around me, my immediate family. And, I can understand how we as women, and I want to say as human beings, we don't like to seem vulnerable. We don't like to seem weak. So we don't ask for help. We don't want that support, or no, we don't say we want the support. We need and we want it. And I believe that Samantha gave the advice of, being able to receive support and help when it's warranted. Because when we're going through a diagnosis, support, love, concern, all those, I'm going to say, elements of helping us stand tall and stand strong are needed. But it's very difficult for us to ask for it. I did learn in my journey as a breast cancer survivor from day one that, being strong and being, okay all the time made my burden heavier because I kept it to myself. You know, when you're able to share that load with other people, you alleviate a lot of your burden. I'm not going to say some of the mental duress and strain that we deal with, but a lot of, okay, the things that we do in our day to day, the cleaning, the cooking, the shopping, the da 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 da. If you're able to allow people in your life to support you with those energy draining activities, then you're able to conserve energy and have that for your healing process. I As a result of my diagnosis, so I went through my diagnosis. I was diagnosed in February. I went through a lumpectomy. I went through chemotherapy, radiation, and by the end of August, after much pushback from my oncologist and my whole medical team, I was able to get on the court and play the last game of that 2002 season. Now, I will say that I only played limited minutes. I will say that I was exhausted beyond imaginable, any imaginable, reason. I felt like being able to get on the court at that point in time was just, basketball had been such a huge part of my life. And we all know, all of the women who are listening, the panelists, you know that when you're going through a diagnosis, one of the biggest things that we strive for is our sense of normalcy. We try to stay plugged into life as we know it. We try not to appear fatigued or limited in any capacity. And I believe that my getting back on the court was psychologically, it was empowering for me. So I encourage anyone to, again, my doctor, Dr. Helen Chu at the University of Davis, California, was amazing. And when I went to her and I said, Dr. Chu, I want to get back on the court for the last game. I was still going through radiation, mind you. She just looked at me like I had three heads. But she said, I just cannot subject you to that. I don't believe you're strong enough, et cetera, et cetera, et cetera, et cetera. Okay, I left her office, and the next week, Dr. Chu, I really feel like I can do this, right? So after about the third or fourth phone call requesting that she release me for this game, she's, okay, all right, I'm going to release you, okay? And I would never, ever recommend that anyone jump into a professional athletic realm while they're going through treatment for any type of cancer, but for breast cancer. But I just felt like I could do it. I felt compelled to do it. I felt inspired to do it. And I believe that when we're operating on that plane, that we're able to do whatever we're inspired to do. So again, that's not for everyone. That's not to go and challenge your physician's orders and things like that. That's for you to follow your gut and your spirit and what's within you and what you believe in, right? as a result of my diagnosis and everything that I went through, I actually went back to school. I became a nurse after my basketball career. I'm an LPN here in the state of California. But in addition to that, I was trying to figure out how I could reach back and share my experience with other breast cancer survivors. That desire resulted in Breathe and Stretch Breast Cancer Recovery Program. And Samantha, when you started talking about epigenetics, I just started smiling inside. And you highlighting that less than 10% of diagnoses are genetically related. Okay, I am a proponent of lifestyle changes. I'm an advocate for people to understand their bodies and how to balance, how to live in homeostasis, how to breathe in a certain way that affects our neurological system, that keeps us out of I'm going to say, fight or flight response, right? So much of our day to day keeps us wound up, and we are living and we are overhauled. We have to reel it back. Stress is at the root of a lot of our chronic diseases. And we all know that cancer, breast cancer, any cancer is now considered a chronic disease, right? So understanding how to live in balance, how our environment, our food, our relationships impact our well-being is critical. I believe that we have the ability to shift our internal environment and subsequently shift our well-being, determine our state of health. But we have to be intentional about it. We have to be motivated to do it. We have to be diligent about it. So many people are eager to go get a pill as opposed to understanding how to eat, understanding how to breathe, understanding how to free your body from restriction. If you're walking around and your neck is tight and your back is tight, your shoulders are tight, that's tension. That must be released in order for your body to function optimally. And so that's what I do. That's what I teach breast cancer survivors, how to free their bodies, how to breathe properly. One of the first things we get when we get out of surgery is what? A spirometer. Okay. Now that spirometer is to prevent DVTs and things like that, and which is deep vein thrombosis, and to help with our blood flow and things like that. But in addition to that, it's working on our lung expansion. I mean, I'm just going to share this story with you all real quick. One of the first times I got on the basketball court, I'm huffing and puffing. I mean, I'm filling up my lungs, and all of a sudden I just had this debilitating pain in my chest. And it was just contraction, just because of right at the wound sites. It was the muscles contracting just from the expansion. We get to this place where we walk guarded, we live guarded, and we shrink instead of expanding and opening up our chest. And then that becomes the way we breathe and the way we move. So when we get to the place where we can understand how to open up the chest, how to free our body, that's when we start to heal, right? This isn't going to be conducive to healing, right? When you can take a deep breath and fill those lungs and expand that chest, now you know that you have full mobility in your thoracic region, right? How many people can do that, take 5 deep breaths and not get just excruciating pain in that region? Months, weeks, months, years does not mean you have healed. Healing requires our intention on it, right? So that's my story. Those are my words of advice. And I thank everyone here for sharing your stories of inspiration and just, I believe that there were so many survivors around me when I was going through my diagnosis. I'm gonna tell you, I clung to them like they had, the fountain of youth. I mean, they were golden to me. I looked at them like they were the best mentors to me. And I hope to be that for someone else. And I know that you all are striving to do the same thing. Thank you for allowing me to have this time and this opportunity to share my story. And hey, I'm open for any questions.
Well, I'm just blown away by every one of you, each story, each message. Edna, that's beautiful. You gave me the opportunity to kind of drop my shoulders and take a breath and and breathe, because it is so important in daily life. And as you mentioned, I think it was an interesting message that for all of you women to hear you all share your stories and know that you're such proponents for going out into the community and doing a forum and a panel like this and talking to other women who may have not experienced breast cancer, who may be breast cancer survivors, may be going through their own battle presently. It's just great strength, it's great knowledge, and it's great candor and honesty. And I think that that is probably the thing that anyone in a breast cancer or any type of cancer diagnosis needs the most, to hear someone else's story and people who have gone through and come out on the other side, not just healthy physically, but healthier mentally, seemingly as well. Dr. Lindsay, I wanted to know if you had any final comments to wrap up based on some of the things you heard from our survivors here talking today.
Yeah, I'm really touched by everyone's story, and what's unique and a little unusual about our three ladies is that all of our survivors that spoke tonight had a palpable mass or a finding that they noticed that wasn't right, that they reached out and stuck to their guns about getting addressed by a physician. And so it's really important to be aware of your body and when there's a difference and to seek out help for that. Only about 20% of breast cancers are diagnosed as a mass you can feel. The other 80% are actually diagnosed with screening imaging. So it is a little unusual, to have three survivors speaking that really had to, push to get their diagnosis and to figure out what was going on when something wasn't right. So that's what struck me listening to their stories.
Mm-hmm. I was also struck too by the fact that each of you, I think, said you had that little voice inside of you, that internal knowledge that something wasn't right. And I think that speaks to just being aware of not only your own body, but listening to your intuition, because intuition can be real. I don't think that it's a medical or a clinical state, but I think that when you have some kind of intuition, it is definitely something that people should listen to. We did have someone who left a comment that I thought was very sweet. It was someone who said that you had done a surgery on her, Dr. Pearson, and that she said you were amazing and that she appreciated you. I don't know where it went, but it was over here on the side. I'd like to thank each and every one of you for being here tonight. This was my pleasure to moderate, and I certainly learned an awful lot. If I can just get a quick closing comment from each of you, Kim and Samantha and Edna, just a little bit about life now and remission. And I don't know if it's maybe a goal or just a thought, a wish, maybe something that you've committed to put forth in your life as a cancer survivor. Go ahead, Kim.
Okay. Well, it took me almost a year to even go public and tell my story because I didn't feel like my cancer was any more tragic than anyone else just because I was on TV or the radio or in the public eye. I didn't really understand why I should even talk about it because I'm not special. It's no more tragic than anyone else who gets cancer. But what I've learned is that you can touch other people's lives because you do have a platform. I started a podcast, Live Fearless with Kim Adams. And, I have on my phone right now, texting with people, women who have just been diagnosed and helping guide them because, you think that someone's going to tell you exactly what to do, but there are a lot of choices when it comes to your treatment, which I wasn't expecting. And so I think it is important, notice all of us have done something after we've gone through this to help others. But I also believe that people have come into my lives. I call it the natural attrition of my friends going through cancer, because I was really surprised. Some people God just kind of removed from my life organically. And then some people who I wasn't really expecting came back into my life. I was listening to Samantha and Edna as well, but Samantha, we have very similar stories with the exception that after breast cancer, I'm not taking care of myself like I should. And I think a lot of cancer patients feel guilty about that. I still eat sugar. I still probably eat things I shouldn't. And I'm not careful about my makeup and what I'm putting into my body. And Edna, I'm not careful about my breathing. You know, I have 5 kids and I am a single mom. And so I'm eating what's left over on their plates, even after cancer. So I kind of think this might have benefited me just as much as everyone else here, because I'm definitely going to hopefully get in touch with both of you, because your journey never ends. Even when you're in remission, you were always a cancer survivor. And I never had a sister, but going through cancer, I have millions of sisters now. And so I thank you both for using your journey and your diagnosis to do better things, and hope to connect with both of you again soon. But for everyone out there, and the doctor touched on this too, if you do find a lump, or if you get a mammogram that says you have a lump, she's, 80% do turn out to be nothing. So I don't want to send the message out that you should just panic, because a lot of them do turn out to be cysts or swollen lymph nodes. It's just that intuition. And if something's wrong, I was losing weight, I was fatigued, there were other symptoms. So that's what you really have to listen to your body. But thank you all. It's such a blessing to be here. And thank you again.
Fantastic. Thanks, Kim. Samantha, closing thoughts?
Closing thoughts are just listen to your body, know your body better than, look, we should know our bodies better than any doctor can, right? When we go in and we say, this isn't right, this is not how my body has been. Know your numbers, whether it's your blood pressure, what's right for you, or your resting heart rate. And also really to try to slowly, in small manageable steps, which is what I do with my private clients and my group webinars and retreats, try to introduce small manageable steps to making lasting changes to reduce the toxins that are on and around your body. From, like Kim said, from how you're eating to what you're using for your makeup, for your period routine.
Mm-hmm.
If you're
Deodorant
using
too is a good
brands,
one.
let me tell you, there's a lot of bleach and adhesive that you don't want in that very delicate and permeable area. So I hope to, hopefully those who are still with us watching, please follow me on Instagram at Samantha Harris TV, where I share a lot of great takeaway tips and tricks and hacks and workouts. We have a little Halloween workout on there today. So
hey, we wanted to get the name of your book again, Samantha, and where people can get it.
Sure. It is called Your Healthiest Healthy. And it's available anywhere books are sold, Amazon, Barnes & Noble. But honestly, I'll tell you a little secret. If you Google it, there are some book discount places that you can get it for a very good price, well off cover price for buying it at Barnes & Noble. Although they'd kill me if they heard me saying that, because they're actually the owners of my publisher. So anyway, but I just rather I want it in people's hands.
I think that's good pandemic reading. All right,
Right.
I want to know also, how can I learn to breathe and heal and have health and all of the great things that you share with people regularly?
Let me see here. Okay, I'm unmuted now. Well, you know what? I want to just go back to Kim. Kim, you said something that, it stuck with me. And you said you're not special and nothing about you is so special. But, I believe that we're all special. We all may have breast cancer diagnoses, but what you have to realize and own is that your story is going to resonate with someone. There's going to be a piece of your story that may inspire another survivor out there like my story would not. Mm-hmm. We're all unique. One of my favorite books is The Little Prince, St. John Exupéry. And one of the quotes in that book says, "You are unique in all the world," right? And I believe that we all have to just own our stories and own them like nobody's business, because there are gems in our stories. Don't shrink back from who we are. I remember feeling embarrassed about being a survivor. I didn't want to tell people, but of course I lived in the public eye. I'd stand and meet someone, "You're Edna Campbell," and the first thing they would do is their eyes would drop to my breast, right? And just feel exposed, vulnerable, all embarrassed, all these things. And then finally, "Yeah, I am," and I expected all of that. "Well, how are you doing?" And all of that. It's who we are. It's the beauty of who we are. It's how we get to live our legacy in this life. These things happen to us for a reason. That's what I believe. And the reason is for us to now extract from those experiences and be able to go impart with the masses the things that we have learned and what has empowered us and given us strength and given us life and health. And so I just want to say, I'm happy and thankful to be a part of this panel. I believe that all are out there living your life's purpose, and know that you are special. We are special. I'm special. You're special. Everyone that's listening, you're special. And your story is unique and special. And I see it as such, and I own it as such. And I'm thankful for everything that is particular to me, because I get to add a little this or that to who Edna has been as a breast cancer survivor, as opposed to, the little thing that Kim gets to add and Samantha gets to add. They're all beautiful, I'm going to say, recipes that you just throw it together and you just get this magnificent, healthy survivor with all of it, right? So I just think that we just have to take time for ourselves. We all get busy, and we are very busy at being distracted with other people. I'm a caregiver. I'm a mom. I'm a nurse. I want to take care of people, right? It is very easy for us to be distracted with other people and helping other people fix their stuff, right? But we first have to fix our stuff, and we have to take that time for our stuff. That would be my bit of advice. So you carve out, I don't know, the first 30 minutes a day, that's your time. That last 30 minutes a day, that's your time. I mean, I know life gets hectic, you travel, you work, you do this, you have projects, but you must take care of you. It's just like, on the plane, every mother, I am sure, if anything would happen, would want to get the oxygen mask and put that mask on their child first. That's instinctive. But we have to always remember, if we are not okay, we cannot take care of the child or the loved one beside us, right? So that's my bit of advice, my parting words. And, this has been a pleasure. Thank you.
Absolutely beautiful. That is the truth. And when you hear that on a plane, you always think, well, wait, what? And then you realize. I do have one question that I see in the chat here from Darlene, if we can perhaps, Dr. Peterson, get you to maybe address this, and any of you ladies as well. Darlene said, I had a lumpectomy in July of 2019, estrogen positive receptor, and now taking anastrozole. I want to make sure I said that properly. Any suggestions on how to handle the side effects of the medication? No estrogen. She said she's really struggling.
Oh, I think our panelists will have a better idea than me, honestly. I'd like to hear what they have to say.
Yes, I have an absolute idea, and I feel you. I was also ERPR positive and ended up having to have a hysterectomy, oophorectomy, which threw me into menopause in one day, and you can't use estrogen replacement. And no one really prepared me. Honestly, the side effects from what I went through after was harder than really in many ways. And so what has helped me is really, you can talk to your doctor about it, but I think Samantha would probably really be able to help you, because I did notice a difference when I had too much caffeine, or I didn't get really the 8 hours sleep. That is one thing I'm really, really good about that I wasn't before, where I get 8 hours sleep no matter what. I have to get that sleep. Because that's when my body is healing. And I noticed that did help with some of the joint pain, but moving, working out. But I think, Samantha, you could probably help with some of those symptoms as well, because the hot flashes, I can't help you. Have a fire extinguisher and a fan, because you could spontaneously combust with hot flashes. But I think Samantha can probably help you with some of the dietary things and working out, which will help as well.
Absolutely. I think it is a huge part of it is making those changes. I also am ERPR positive, HER2 negative. For me, we talked about having a oophorectomy. I haven't gone down that route yet. So Kim, I feel you, because even just on the tamoxifen that I've been on for 6.5 years, it's like the night sweats. I'm like, oh my God. But I went through acupuncture. I tried all different things. And then I learned I just needed to deal with the night sweats and breathe through them and understand that this was just a part of the process, and I was going to hit menopause at some point anyway, and it was going to happen, so just a little earlier. But in terms of fatigue and in terms of so many of the other issues, we can do a lot of benefit for ourselves with diet, and how we're eating, and also by getting the toxins out of our system by what we're right now adding into it through our makeup and our hair care products and our personal care products and our cleaning products. But in the way I address it is in a very non-overwhelming way, because we can't make a 180 overnight and expect for that to stick for a lifetime. It is about small, manageable steps that fit into your lifestyle. We all are bio individuals. What works well for me may not work well for Kim, and what works well for Kim may not work well for Edna, and so on. So I know that we're already running over our time. I want to be respectful of everyone who's not only the panelists, but all of the attendees. I'll leave you all with this. For everyone attending, including the panelists, if anyone is interested, I would love to give an offer of a 25-minute free health consult with me. Obviously it'll be first come, first serve, and based on what I can do with my schedule, but I always will try to fit as many of you in as possible, hopefully before the holidays and maybe even sooner. So in order to do that, follow me on Instagram at Samantha Harris TV. Great. And then send me a DM saying, hey, I was on the Pistons panel, and or attendee, and I want to do that. And then I'll make sure I get your email, and I'll email you to go ahead and set that up.
That's awesome. Edna and Kim, how can people reach you on social media? Is there a link you prefer, an option? Instagram, Twitter, Facebook?
Yeah, for me, it's just at Real Kim Adams on Instagram. So at Real Kim Adams. And then my podcast, Live Fearless with Kim Adams, is on Apple, iTunes, anywhere you get your podcasts. And if you have an idea for a topic, or if you'd like to be a guest, I'm always looking for that. And if you are in the Metro Detroit area, I do also, well before COVID, a lot of women, I've gone to mammograms with a few women who'd never gone to a mammogram because they were afraid. And I went with them, because if they need somewhere to go, then I'll do that. And one of the women, she ended up having stage 1 breast cancer, and she was 50 and never had a mammogram. It's not scary. There's nothing to be scared of. So once COVID is over, obviously I can't go now with you, but certainly I'm willing to support you in any way. DM me. Again, it's at Real Kim Adams.
Terrific.
Kim, that's amazing. And Kim, maybe you should put that in the chat. I also put in the chat information for how to get a hold of me if any of you want to take me up on my offer for the free consult. So
I do. I get dibs.
Edna, how can we find you, and what do you have?
You can find me all over social media, just Edna Campbell, and also my website, breatheandstretch.com.
Beautiful. All right, ladies. Well, thank you for staying over. It was an amazing panel. I can't think of anyone that I would have rather spent a little bit of time on my Thursday with, and I know that I will definitely go to bed with a new appreciation for sisterhood and what you have all been through and what you continue to share and do. Our thanks to the Detroit Pistons for putting on this amazing panel, and hopefully we can be together soon and at a Pistons game. And Dr. Peterson, thank you as well for your time. Once again, for Kim Adams and Samantha Harris and Edna Campbell, I'm Jennifer Hammond. Thank you all for joining us.